While COVID-19 is in the news, there are still other medical conditions that we cannot forget. Call in your questions about diabetes, heart disease, or even coronavirus. It's Ask Anything, tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. I'm your Prairie Doc, Dr. Jill Kruse. For the past few weeks, we have been focusing upon various aspects of the coronavirus or COVID-19. But we know you all may have other health concerns, so it's time for Ask Anything. Please call, email, or text your questions about any health-related matter, including COVID-19 if you like. Joining us tonight via Zoom, Dr. Cathy Leadabrand, a hospitalist with Brookings Health System, and via Skype, Dr. Jennifer Williamson with Monument Health, Rapid City, South Dakota. Welcome, both of you. Cathy, let's just get started. Could you explain to our viewers what exactly is a hospitalist?
Well, a hospitalist is a physician that has specialized in taking care of patients in the hospital. We can have various backgrounds, for instance, family practice or internal medicine is my specialty, but I've specialized further and I take care of patients from the time that they're admitted to the hospital through their hospital stay and to discharge. And then I kind of pass the torch back to their family physician, and we work as a team to try and keep them healthy.
Excellent. And Dr. Williamson, do you want to tell us a little bit about your background and what your specialty is?
So I'm also in internal medicine like Dr. Leadabrand, but I'm now doing outpatient primary care with the focus on health preventative measures, as well as also treating patients with chronic comorbidities or out of hospital, but with a special focus on ensuring that patients are healthy, remaining in the community with less likelihood of being hospitalized. So my focus is primarily on preventative health care, while I also treat secondary health conditions or chronic health conditions.
Excellent. Well, we have a few questions here already, and we'll start with some COVID-19 and get that going right now. One emailer had a question and said that they had the Hong Kong flu back in 1969, and he or she wondered if those antibodies would still be in their system, and if so, would they weaken the effect of the coronavirus? Do either of you have any thoughts on that?
I'll jump in. So the Hong Kong flu would have been a form of influenza, and so the coronavirus is in a different family of viruses, so you wouldn't expect that to provide any protection. Also, with it being so long ago, my understanding is with influenza in general, you do get antibodies, and that does confer sometimes some protection for the next season. It just depends how similar the virus is. But usually that would only last 2 or 3 years would be my expectation.
Yeah, so sounds like, different virus, so we wouldn't expect there to be any crossover, and with it being that far away, we also wouldn't expect there to be a significant amount of antibodies still in the system to that. So, good. All right. Another question with that is, could there be any added benefits with all the social distancing, since people are not shaking hands or they're not congregating, they're wearing masks, washing their hands more often? Have either of you noticed that there are a few people that are getting sick with, kind of colds, influenza, hand, foot, and mouth, or any of those other general viral things that are kind of going around this time of year? Dr. Williamson, what have you seen in the clinic?
Well, to be honest, an objective measure of the effect of social distancing might not be realized until sometime in the future, because in general, many patients are reluctant at this time to seek medical care except for very dire medical circumstances. Only the very few and brave of heart has been showing up for medical care. That being said, there are benefits to social distancing to avoid spread of respiratory condition, but most benefit can be conferred by proper hygiene practices for prevention of respiratory conditions in general.
Yes, and I think there's a very interesting, the South Dakota Department of Public Health does a graph every week kind of showing with influenza-like activity, and when we started doing social distancing, the number of influenza-like cases significantly dropped off. So I definitely think that this is doing something not just for preventing the spread of coronavirus specifically, but a lot of other respiratory illnesses.
Conditions.
Definitely. All right. Another question with this, and then we'll move on to some non-COVID questions. A gentleman from Sioux Falls asks, for COVID-19, what is my biggest risk factor? Coronary artery disease, diabetes, or a right bundle branch block? I would ask Dr. Leadabrand, if you had a patient that had diabetes, coronary artery disease, and a right bundle branch block, which one would you be watching the most closely for if they were hospitalized with COVID?
Well, I guess from what I've heard, the diseases that especially affect the blood seem to be the highest risk diseases. Now, coronary artery disease, you already know you have blood vessel disease. And usually if you have disease in your coronary arteries, you can guess that probably many other arteries in the body are affected too. So I guess I would be most concerned about that, although diabetes also often does correlate with blood vessel disease. A right bundle branch block could have been reflect prior heart damage, but also probably more often reflects perhaps some trouble in the lungs, and that puts some strain on the right side of the heart. But surprisingly, chronic lung disease is a risk factor, but we aren't seeing as many problems in people with asthma as we expected. It seems to be the highest risk seems to be people with the diseases of the blood vessels. So we'll have to see as more data comes in, but at this point in time, my guess would be I'd be most concerned about the patient with coronary artery disease.
Yes, definitely. And as we're learning with this virus, we're constantly learning new things about it, and it does seem that we're writing the textbook in real time here. So what we're learning today may not be what we're preaching, next week. So definitely we have to kind of keep an open mind that we don't know everything, and at this point we're doing the best that we can with the information we have, and that's why it's so important for all these health systems to be doing studies and research and sharing the information that we do have between physicians and other people who are providing care for COVID-19. So, good. All right. Well, we'll get to, we've talked about COVID so much, we should get into a little bit of non-COVID here. So, the 70-year-old woman from Sioux Falls asks, I wake up in the morning with both arms tingling. Could that be from nerves, or could it be from something else? So, say, Dr. Williamson, do you have any thoughts on that? If someone came in and said that in your clinic, my arms tingle, both arms, what other questions would you want to know, or what would you be looking in your differential for things to be concerned about with that?
Now, for a patient to clearly state that he or she wakes up in the morning with both arms tingling, then my suspicion will be, based on that historical data, that it's likely due to the position of the patient overnight. Providing the patient does not have any tingling throughout the day or any other times, if it's just confined to when he or she's at rest, then I'll be suspicious for nerve root compression, the brachial plexus, C5, C6, 78, 1, all in this lower cervical region. How does the patient sleep? So I would ask questions like, how do you sleep? Is the tingling confined to any particular side? Is it worse on the left versus the right, or the other way around? Is there any weakness in the hands? How long does it last for? Does it go away once you proceed with your day? How about elevating your arm above your head? When you do that, do you experience similar symptoms? And then I would go on to actually do an examination in office to see whether or not there is any compression, anything suggestive of compression of the nerve root at the cervical spine level. So that would be my primary focus. What specifically happens overnight versus during the day, that would help us to be keyed into this diagnosis. Yes,
very good. It's very hard with just one sentence to come up with a specific answer, which is why the physical exam is so important, and that relationship with your doctor to know what your history is, what medications you're taking, what other health problems you have. Do you have a bad back? Do you have a bad neck? Definitely, would be hard to say, but that's, again, that's seeing your physician is always a good way to kind of go through those answers. So another question here, a gentleman from Aberdeen asks, I have swelling of the ankles. I try to keep my fluid intake less than 50 ounces or 1,500 milliliters. What else can I do to help? So Dr. Leadabrand, what would you recommend for someone who has ankle swelling and is definitely trying to restrict fluids? Anything else that you would recommend for them?
Well, So I'm going to assume that the ankles aren't very inflamed, that there's not a lot of redness or a bad arthritis going on, because certain forms of arthritis, gout and osteoarthritis, can cause some swelling too. But assuming that it's mainly the puffiness and the swelling, one of the most common problems is the insufficiency of the veins. They're a low pressure system, and so the fluid can kind of pool down by gravity down towards your ankles and then get out into the tissues and be hard to get rid of. A few of the things you want to do are to compress the veins with compression socks that you could wear during the day, elevating the legs, limiting water, limiting your fluid is kind of more of an advanced thing we'll try in patients when we can't control it by other means. But one of the best ways would be to limit your salt, because the salt gets in the tissues and then pulls the fluid along with it. And then there might be other reasons why people have swelling. Now, if both ankles are swollen, you wouldn't be as concerned, for instance, about blood clots in the calves. But if it's one side that's far more swollen than the other and you're having pain with it, then you have to start looking at other causes. Some people have retained fluid because of heart conditions too, but restricting fluid, controlling your salt, and then sometimes adding medications at the instruction of your care provider, like a water pill, can be helpful too.
Excellent. I think was a very good, concise answer. Since April is Diabetes Awareness Month, we asked an expert to share some information about the prevalence of prediabetes and what can be done to reverse the upward trend of this disease.
Prediabetes means that your blood glucose or blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes, which is the most common form of diabetes. Prediabetes affects so many Americans. 84 million Americans have prediabetes. In South Dakota alone, it's over 200,000 people, adults with prediabetes. So we're talking about 1 out of 3 adults have this condition. People what puts you at risk for diabetes are certain factors. Some of them you can't change, such as your age, your race or ethnicity, African American, Asian American, Native American, Hawaiian and Alaskan Pacific natives are more likely to get prediabetes. But there's also things such as being overweight and not regularly getting enough physical activity. An online risk test, you can go to doihaveprediabetes.com, or if you're in South Dakota, you can go to a website called undotherisk.com. And there's a simple online test. It only takes about 60 seconds to complete. You'll answer some health questions. It's anonymous, it's free. You can just find out, and if the test does show that you're at risk, you can go to your healthcare provider and they can do a simple blood test. And the blood test is either a fasting blood glucose, an A1C test, which is a measure of your blood glucose over a period of time, or an oral glucose tolerance test. So that can confirm whether you, in fact, do have it or not. And if you do find out you have it, there's steps that you can do to prevent it or delay as long as possible that diagnosis of type 2 diabetes. So the National Diabetes Prevention Program, Lifestyle Change Program, is a 1-year-long structured lifestyle change program. This is where a group of participants gather together. You do have to have a certain criteria. You have to have prediabetes or at high risk for diabetes to be in this group. And it's taught or facilitated by a trained lifestyle coach, and this coach walks people through simple things that people can be doing to take better care of themselves, eating well, getting regular physical activity, managing stress, and it's done in a group facilitation. So what strategies may work for one person may not work for another, so it's really using the group support to go through and try to help people lose just a modest amount of weight loss and to make some really lifestyle changes in the way that they're living. Go through a structured lifestyle change program, they can reduce the risk of diabetes by 58%, for type 2 diabetes by 58%, which is really incredible, and it can really impact and change lives. So prediabetes can be reversed with simple lifestyle changes. And those healthy lifestyle changes would include, managing and eating a healthier diet and making sure that you're getting regular physical activity. We're talking about a modest amount. It's about 150 minutes a week. That's about 30 minutes 5 times on most days of the week. And we're talking about brisk walking, making sure that you're doing something that you enjoy doing. It could be dancing, it could be walking, it could be gardening, anything that's going to get your heart rate just a little bit up.
This is your program, and your questions are key to the direction of our discussion. Call in your questions at 1-888-376-6225 or send us an email at ask@prairiedoc.org. Excellent. Well, a few more questions came in while we were at that video clip here. A woman from Sioux Falls asked if a pacemaker increases your risk of COVID-19. Dr. Leadabrand, have any thoughts on that?
My suspicion is it does not itself increase the risk. I guess I haven't heard of any data on that. But now I suppose if it's associated with another cardiac condition, then that would be a concern, but many people need pacemakers because of just some defective wiring in the heart, and that solves the problem. And I would think that perhaps it'd be similar. I do know that COVID can cause irregular heart rhythms, and perhaps someone who required a pacemaker may be more likely to have that tendency to have irregularities, but I guess I'd have to wait for more data on that.
Excellent. Well, here's one I think all three of us will answer. Someone asked via email, what changes have you made personally and your family made due to COVID-19? And do you recommend wearing masks in public? Dr. Williamson, have you done anything differently? I know you've got children at home as well. So are you and they doing anything different right now?
Yes, so definitely. Previously, I would have the kids out in a more social setting, playing with other children. Now, since this onset of the COVID-19 pandemic, they have been largely confined to the outdoors, but with us as their nuclear family, not with other family members or other friends. Myself at work, of course, I'm seeing patient, and I will continue to see patient until I feel personally unsafe, but I wear a surgical mask while I'm seeing my patient. And if I'm required, of course, to see patients who are known to be infected with COVID-19, then of course my protection level will increase as is appropriate. But socially, when I go outside to the supermarket or to other places, which I hardly do these days, I also use a protective face covering, and my family members also do the same. So in the answer to that, yes, we have made changes. We continue to be active because we don't want to encourage people to stay home and be sedentary on account of this condition, but use the protective recommended measures that we have been advocating as a group, as a profession, and also as a state, and even as a country. So while you're out exercising and with your family and shopping, use the face mask until we have data that speaks or show otherwise, and practice safe social distances based on the current guidelines. Of course, this could change, and we will continue to make recommendations and update them as more information comes in.
Definitely, thank you. And Dr. Leadabrand, have you been doing anything differently and your family as well?
Yeah, we've been trying to be very careful. We have several extended family members in town, many of whom have high-risk conditions, and we haven't seen them since probably the end of February when this all started. So we've been keeping our distance that way. When I get off work, I've been changing out of my clothes, my work clothes, if I've been exposed to, well, in general, these days we don't know. We may very well be exposed to patients that have COVID and who are not even having symptoms and maybe in the hospital for something else. But I'm changing out of my work clothes and make sure that I put the laundry separately, and I do my own laundry, and we're trying to be as careful as we can. And I too wear masks when I'm out in public, and kind of what Dr. Williamson said, following about those same precautions.
Excellent. Yes, me as well. My family, I have two children who are in elementary school, so we've been trying to keep them active in our backyard. They've been playing a lot on the trampoline and running and trying to be active there and not cooped up in the house and still doing their schoolwork, which has been challenging because I've still been going to work every day, and my husband is an ER nurse. So we do have a very unique situation that both of us are in these essential roles where we're both potentially exposed to COVID. So this week I'm doing COVID testing in the clinic and seeing all the patients in the respiratory clinic. So this week I have been in scrubs, different shoes that only stay in the garage, they never go into the house. I change as soon as I get home. When I'm at work, I am in full PPE, meaning I'm wearing a gown, and I'm wearing gloves, and actually double gloves. I'm wearing an N95 mask, and I'm wearing a face shield as well as a head covering. So I do feel that Avera Medical Group has been very proactive at providing me and my colleagues with the personal protective equipment that we need to keep ourselves safe. And I feel very safe taking care of patients at this time. But know that when I get home, the first thing I do is, take the shoes off, which stay in the garage, go downstairs, take a shower. Again, yes, all those clothes stay separate, and I'm the only one that touches them. I'm the only one that washes them. And then try to go on and live my life and be with my family. My children haven't seen their grandparents who they used to spend the weekend with them almost monthly. They haven't seen them since, I would want to say, in February as well, because my parents are both also high risk, so we don't want to put them at any risk. So we've been doing a lot of FaceTime and a lot of Skype and a lot of Zoom, and trying to keep our children educated and social, and trying to keep ourselves safe and not expose anyone else needlessly. So our runs to the grocery store have been very, very limited, and we make a huge list and try to make those times as spaced out as far as possible. Wear a mask when we go into the store, and definitely try to keep myself safe. And when I go out, I always act as if I assume that I am an asymptomatic person with it, and how should I act if I thought I could potentially spread it to someone else? So that really helps me be more cognizant and really try to follow those guidelines when I'm among other people, because I know that I have had more exposure than my neighbors across the street have. So definitely it has changed how we live and how we act, and we're trying to be prudent and cautious and know that this could potentially affect both my husband and me, and coming up with contingency plans of what to do if one or both of us became sick, and who would take care of our children, because that's a very real concern for us. So it is something that we're taking very seriously, and want to make sure that we do everything right. So we're following CDC guidance and updating it as better information becomes available. So that's what we're doing here in Brookings. So, all right. We'll do one more COVID test and question, and then we'll get to some non-COVID because those are also very important. So an emailer asks, how long after COVID testing are results available? And I can answer this one since I am literally the person doing the COVID testing this week. So what we have been telling patients is to expect a result within 2 to 4 days. Although all the tests I've done this week, we've had the results the following day. So it was at one point, there was a serious backlog, but now as more laboratories have been certified at Avera, Sanford, Mayo, the State Health Department, now those tests are getting spread out between multiple labs, so we definitely don't have the backlog that we did initially. For a while it was taking several days, but now the turnaround time has been very good. So have you been seeing anything different in the hospital with testing, Dr. Leadabrand?
I think it's gotten better. It was 70, at first it was running 72 hours, and it's been at least down to 48 hours, I think. But.
Excellent. And Dr. Williamson, anything different West River?
The timing has definitely improved, definitely. So on average, I would say 48 hours, definitely so.
Yes, definite. All right, well, let's take a break from COVID because all COVID all the time is kind of exhausting for all of us to live in. So we'll talk to these other things that haven't been necessarily addressed because you haven't been able to get into your regular doctor. So a woman from Lake Preston says that when she eats, her abdomen gets hard right under her ribs there. She does not have pain, but states it goes away after several hours. What could that be? She says she doesn't have heartburn. Either of you have any thoughts on that?
Well, it sounds like one thing could be gas. It could be some gas building up in the first part of the intestine or the part of the stomach, or perhaps her stomach isn't emptying as well as it should. Some patients, for instance, with diabetes, the stomach slows down as it empties, and you can get a sensation of fullness there. I'll let Dr. Williamson. Do you have other things you might be thinking of?
Along the same line, I was wondering whether or not, similarly to what you said, I was wondering if she has any associated symptoms, nausea, dry heaves, even vomiting, because while gaseous distension of the abdomen is quite common, as Dr. Leadabrand pointed out, there's also possibility of having gastric or delayed gastric emptying, especially in patients with comorbidities that can affect the autonomic nervous plexus in the gut, like namely patients with diabetes, for example. So we would need more information to give a more guided response. But again, gaseous distension is common. And less common, but still not very uncommon, is the phenomenon of delayed gastric emptying, in which case the patient will present with not just a distension, but also they are often nauseated. So that would definitely, an exploration of the patient's symptoms and history would give us a more guided direction to give a better response.
Excellent. Thank you so much. Both of you have very, very articulate and thoughtful answers, which I definitely appreciate. One of the ballot measures that South Dakota voters will be deciding this November includes legalization of medical marijuana. Before he passed away just over a month ago, Dr. Holm provided his views about cannabis. While he said he wasn't in favor of marijuana use among young people because of its effect on the developing brain, he said it offered advantages for some adults.
My personal bias would be that we legalize it and we make it available to adults, past 25 or thereabouts. And I think that legalizing the darn stuff, I say that as a humorous thing, would be a wonderful thing. I do think that I should mention that there's some dependence. Not a ton of it, but there is some dependence on it. I think it probably raises the risk of automobile accidents. And we have to remember the vape contamination issue that occurred. We have thought about it as a recreational drug. And oh, by the way, it's significant relief of abdominal pain. It relieves nausea. It would have a tremendous economic boon to South Dakota. In this world of 70,000 people dying every year, suffocating from opioids, there's so many opioids out there. And with this scenario, we need some relief. So a bottom line is that there are tremendous advantages to marijuana, and that the last thing that I would want to see is it forbidden. And I must say that from a position of a guy who's on his dying day, that it's given me great relief from pain. We need to do something to help relieve that pain. I'm honored to be asked to present to this group, and I hope that it's something of use to you all.
Welcome back to our show tonight. It's always bittersweet to see videos of Dr. Holm that he recorded before he passed away. So definitely an amazing mentor and friend that we all miss dearly. So in the spirit of his Ask Anything, we'll keep up with questions and answer what you need to know and want to know today. So a gentleman from Watertown says he has always had a high white blood cell count, around 14 to 15. He's had all of his teeth pulled, and no one can really explain this. What should he do? So Dr. Leadabrand with the Watertown hometown. So why, would you like to answer that for your fellow hometown person?
Yeah, well, again, one question always triggers a bunch of other questions, and I would definitely want, if I were taking care of this gentleman, I'd want to see in person and ask a few more things. But a few things you need to think about: white blood cells are cells that fight infection, so and also can be elevated in times of inflammation. So, of course, when someone has a high white blood cell count, you often do wonder about is there an infection somewhere? And by having all of his teeth pulled, that helps. That takes that out of the equation. Is there some other simmering infection or inflammation? People, for instance, with rheumatoid arthritis or certain other inflammatory conditions may have high white blood cells. If a person's on steroids chronically, say for lung disease, that can raise the white count. And then there are times when people have overproduction of white blood cells, either due to abnormal cell, something like a leukemia, or even before a leukemia develops, or just a basic abnormality of the bone marrow, you can have a prominent, a higher level. And then you have to remember that these normal ranges are based on statistics. And so there are people who may have, that may be normal for them. They're just in that top, that 5% that falls outside the bell curve. Certainly wouldn't want to jump to the worst case scenario, but it definitely would be something you would want to investigate further, and probably, if else fails, talk to a blood doctor, a hematologist, to help sort through the different possibilities.
Yeah, that was definitely my thought too. If there's ever something that has me stumped, I always think, who's the next level up that I can ask? There's always doctors who spend their time studying one specific area of the body and like to know it, the depth of the ocean, whereas family practice, I need to know the surface area of the ocean. So I need to know just enough to know who's the right person to get it to you. So if you stump me, I would agree seeing a hematologist would be a really good next step option to try to figure out what's going on if it's something to do with the blood. So another Facebook viewer states, now that we can spend a little time outside, what's the recommended level of SPF sunscreen for adults and also for grandkids 5 and younger? So I will let you two handle the adults and I can handle the kids since that's my area of training. So Dr. Williamson, what would you recommend for SPF rating for sunscreen?
So SPF rating for sunscreen, I mean, I've come across various recommendations and I don't want to speak against what the Dermatological Society would recommend, but I would say 30 to 50 would be an adequate range. And bear in mind, it's a time of day for the sun exposure. So full cover up as well, not just the sunscreen. In addition to using sunscreen, we would recommend that there is appropriate headwear to protect the head. There's also appropriate eyewear to protect the eyes from harmful UVA and B. And the time of day that the sun exposure will be got is also very important. Early morning, well, let me not say early morning, mid-morning sunlight would be the best, as opposed to midday and later on when there is a high harmful rays coming through. So the time of exposure, time of day of exposure, the other protective measures that are used, such as headwear, eyewear, and also the duration of the exposure. So just remember, it's not just to lather on and go in the sun. Usually we recommend that you reapply the skin care product or the skin protective product after 15 minutes of sun exposure.
Definitely. So those principles basically apply to children as well. The exception is children younger than 6 months. We don't want to put sunscreen on them because their skin is so sensitive at that age, and we recommend covering them up. Again, the best defense is frequent reapplying and keeping out of the sun, especially when it's directly overhead, that 10 a.m. to 2 p.m. time when the rays are the most direct. Also, the SPF rating is a logarithmic scale, which now, thanks to COVID, all people are used to seeing those scales. So if you get an SPF of 50 and an SPF of 100, there's not a significant improvement or change. That's kind of why that 35 is that baseline, because between 35 and 50, you're getting maybe 1 or 2% better protection at that. So it's not that it's 50 times better when you go from 50 to 100. So that's just something to keep in mind there. So we'll go back to a few of the COVID-related questions here. A woman from Yankton asks, why are the immunosuppressed still at risk even if they wear an N95 mask? Dr. Leadabrand, do you have any thoughts on that?
Well, the N95, it's 95% of the particles won't get through, but there's still that chance of, even with a mask on, that you would be exposed. But also, if you're around someone, you can get the virus maybe on your clothing, on your hands, in your hair. And so the N95 alone doesn't protect you completely. And if you have an immune condition where your immune system isn't as robust, then you're going to have that much more difficulty fighting off the virus particles that do get through. So nothing is 100% protective.
Exactly. So a woman from Sioux Falls asks, is there anything to kill the virus in the air to protect healthcare workers? Could they walk through an ozone chamber or something? I can't say that I have heard of anything like that. That sounds really fascinating, but I don't know where we would get one. Have you heard of anything to disinfect the room or to get rid of those respiratory? I know we're using a lot of the negative pressure rooms in the hospital, so we're keeping the air in that room and not circulating to the rest of the hospital. Dr. Williamson, do you have any other ideas of what we're doing to protect healthcare workers, the environment?
So interestingly, I've heard of theoretically things being done in terms of special UV radiation to kill germs on the protective equipment itself. But for the room or the actual environment, it would be wonderful if such measures be extrapolated and that they actually work. So I'm aware of what is being done for the personal protective equipment, namely the mask, because the biggest concern at this time is for the N95 and other mask that we use and its availability. So I've heard of different studies in scientific literature, engineering things in other scientific ways, recommendations being born out of a disaster and desperate need, recommendations and things developed at other places, like in Nebraska, University of Nebraska, other places, just to name one that comes to the top of my mind. But for the actual environment, the room for decontamination, I'm sure that as this disease continues and we learn more about it, and I'm sure that those measures will be developed with all the great minds being put together, and some of them will definitely work.
Okay, excellent. An emailer asks, I have mild carpal tunnel. When is the proper time to start care with the doctor? Well, as someone who actually had mild carpal tunnel myself during medical school, I would say, when does it bother you? And if it's something where the hands are numb all the time and you can't get it better by just kind of shaking them out, if it's getting to the point where it's there all the time, no matter what you do, get in to see a doctor. And that's when you'd want to start getting that looked at. You know, if it's just mild and positional and you say, oh, it's just when I'm riding my bike or on the steering wheel, my wrists are flexed, or just in the morning, and you know, it goes away after a few minutes, that I would kind of keep what we call watchful waiting. So kind of monitor it. If it gets to the point where, yeah, those fingers are numb all the time and no matter what you do, it doesn't get better, that's when that's telling us that that nerve is constantly compressed and we want to do something about it. So that would be that's what I did from personal experience, and that seemed to be good. We were able to catch it before it needed any surgical intervention, which is great. So next question, a man age 62 is taking 10 milligrams of amlodipine and started using a stand-up desk all day at work, and since doing that has noticed some swelling in his ankles, and then the swelling goes away at night. Should he be concerned? Dr. Leadabrand, what would you say to that patient?
Because with the earlier question, that was one thing I forgot to mention. An awful lot of medications can cause swelling as a side effect, and amlodipine is one of the major ones. Many people do get some puffiness about the ankles, and if it's not bothering him, again, some people will just put up with it, and especially if he's using the stand-up desk, then he's gravity is working even harder at getting that fluid down to his ankles. But using the support stockings could be helpful. And I forgot to mention earlier that just walking periodically and pumping those veins and getting the blood shifted up pumped towards the heart, that will help too. Being sure to, when he isn't at his desk, when he's sitting, to keep those legs elevated would be helpful. And then sometimes a water pill is another medicine that can help with blood pressure, and some people will use a combination with amlodipine, and sometimes that offsets the swelling too. But so those are a few ideas.
Excellent, very good. So a gentleman from Sioux Falls states he has not had any vaccines for over 40 years and never gets sick. He knows that we get in contact with bacteria and viruses on a daily basis and form antibodies. He was wondering if that exposure is what's protecting him from other new bacteria and viruses. Dr. Williamson, any thought on that? Or is he just a lucky person with an amazing immune system?
Well, it could be one of several things. I'm not sure of this gentleman's background and what preventative health care measures he takes, whether he exercises regularly, he eats very healthy, he limits pro-inflammatory foods or foods that cause very lazy leukocytes or lazy function of his white blood cells. I'm not sure of any of those things because we don't have that information. What I do know is that if he is not exposed to any of those common preventable or preventable infectious diseases, then we won't know whether or not he just has a good immune system. Then we also have to consider the concept of herd immunity. In populations where we have a very high rate of immunizations, those who have deferred their immunizations actually benefit from what the others have done. So I'm not saying that he should not go out and be immunized, but he could also be benefiting from herd immunity, meaning that the others who are protected are also protecting him in some essence. That being said, I would still recommend that he receives an update of all his immunizations, because the only reason why we're able to have this herd immunity is because of high rates of immunization within the population.
Excellent. And that's part of the problem with the COVID-19. There is no herd immunity because it's a new virus and none of us have ever seen it, and we don't have any way to fight against it. So, another question here. An emailer asks, I recently had a slight stroke that resulted in some numbness to the right side of her upper lip. The lip is slowly regaining normal feeling. Will other areas return to normal? Unfortunately, they're not able to take therapy at this time. I know, Dr. Leadabrand, you treat and see a lot of patients in the hospital with stroke that have some residual issues. Is there a time frame where we would expect return to happen? And I know it's so individualized.
Yeah, it really is. I'm always amazed, though, at how the body can heal with time. Usually, in my general experience, the most rapid improvement occurs usually in that first month after the stroke. But I've had patients that maybe 5 years out from a stroke, 10 years out from a stroke, and I've seen many of them get gradual improvement. The brain, often new blood vessels, maybe there's new blood supply around the area that was damaged or blocked. Sometimes there's new neural pathways that are learned. So it never ceases to amaze me how the body can heal, even from some major devastatingly bad insults.
Yes, I know. The human body never ceases to amaze me, and it is completely a miracle that we get to take care of people each day and see how amazing it works and how much can happen and get better, and how the body is able to heal itself if we just kind of nudge it in the right direction. So definitely our goal is to do everything we can to help people live their healthiest life and not make anything better, or not make anything worse, and actually help guide them to a better, healthier life here. So one quick last question here. A caller from Lake Preston asks, what is the cost of the COVID-19 test? And at this time, the test out-of-pocket cost for each patient should be $0 at this time. So on that note, we'll be right back after this.
We feel privileged to have had the honor of creating a legacy of service through the Prairie Doc organization.
It has been our desire and goal to share health information that is not influenced by marketing or sales, but rather is based on science.
We started in the 80s with a newspaper article and expanded in the 90s with a radio show. In 2003, we started a TV program, and in 2010, we added our social media platforms.
This has been a team effort made possible by many volunteer physicians and experts serving as hosts and guests. All of them are Prairie Docs.
Thanks to them, we've been given the ability to pass the torch so that this legacy may continue beyond my time on this earth.
Please join me in embracing our team of Prairie Doc physicians, each committed to this mission. Family physician Andrew Ellsworth, Deb Johnston, and Jill Kruse, along with internist Kelly Evans, all from Brookings, South Dakota.
These volunteer physicians, and many others, have in the past and will in the future serve as authors of Prairie Doc newspaper columns, host of our TV and radio programs. Thank you.
When my mom called me and said that my dad found 4 N95 masks in the garage, and she wanted to send them all to me since I'm a doctor, That's love. When I reassured her that we had enough in the clinic for now and that she should keep them, or at least keep 2 for her and Dad, that's love. When I received the box in the mail, all 4 masks were there, lovingly wrapped in tissue paper with a note of encouragement. That's love. When I come home from work, my children run to the top of the stairs yelling out, "Mommy's home!" That's love. When I stop them from coming down the landing until I can shower and change in the downstairs bathroom, because I'm scared I might bring the virus home and I want to do everything I can to protect them, that's love. When a patient sends a message to local healthcare workers that they're thinking of us and praying that we stay well, that's love. When essential workers in any profession show up to support their families and their coworkers every day, that's love. When the local theater department makes masks for the hospital and uses it as a final project for students, that's love. When you order a takeout meal from a local restaurant or buy a gift card from a local small business, that's love. When you turn off the news and call a friend instead so neither of you are so lonely, that's love. When you practice social distancing, not because you are afraid, but because you do not want to add to anyone else's risk, that's love. When teachers completely change the way they teach with only a few days to prepare, and their eyes light up with happiness when they see their students on a Zoom meeting, that's love. When you are frustrated, angry, scared, or just don't know what else to do, look for the love. It's all around you. Sometimes we do not see it, but because we are so overwhelmed with all of these other waves of emotion that try to drown it out. But it is there. It's always there. That's love, waiting for you to find it. A big thank you to our guests, Doctors Cathy and Jennifer, for volunteering to join us remotely and add their experience and knowledge to our discussion tonight. If you would like more information about this program or to see more episodes, please like and follow us on Facebook or visit us at prairiedoc.org. That does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, please wash your hands and stay healthy out there, people. The physical tolls of injury or aging are obvious, but what is the impact of Parkinson's or other dementia-type afflictions when the brain of ours starts to fail? Next time, On Call with the Prairie Doc.
Hello to all. I am Dr. Tom Luzier, a practicing allergist in Aberdeen, South Dakota. Born in Kansas, I embraced the diversity of South Dakota. This diversity comes with a price: limited healthcare resources and information. The Healing Words Foundation, through Prairie Doc, provides an open, online, interactive, public broadcasting format for reliable health information. As a member of the Healing Words Foundation Board, I am asking you please to join me in support of this work, which is funded entirely by donations from you. Please consider making a personal or corporate gift to Healing Words Foundation, a 501c3. Go to prairiedoc.org and click on the donate button and make a valuable contribution. Thank you.
Major funding for On Call with Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
And with the ongoing support of these individuals and institutions, South Dakota Foundation for Medical Care, Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Urology Specialists, Brown Clinic, American Academy of Family Physicians Foundation, and South Dakota Academy of Family Physicians, Black Hills Medical Society, Aberdeen District Medical Society, Flandreau Madison Brookings District Medical Society, Sioux Falls District Medical Society, Yankton District Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care, Sanford Clinic Community Services Committee, Aberdeen Asthma and Allergy, and Swiftel Communications.